Welcome back. March is Colorectal Cancer Awareness Month. Dr. Ramsey Asune with TriStar Southern Hills Medical Center joins me now. Thanks for being here.
Yeah, thank you for having me.
It's an important topic to shed light on as more and more young people especially are being diagnosed with colorectal cancer. But to go to the basics, what exactly is this string of cancer?
Yeah, so colorectal cancer is a cancer of the colon or the rectum, which are the last part of the digestive tract. Most of the time, these start as small precancerous growths called polyps that develop over time. Fortunately, these take years to develop into cancer, which gives us an opportunity to intervene and prevent it from turning cancer altogether. This emphasizes the need for screening tests, including colonoscopy, which allow us to diagnose colorectal cancer, but also prevent it entirely.
And from your experience, why is this an important topic to discuss?
Yeah, 1 in 24 people develop colorectal cancer in their lifetime. This unfortunately makes it one of the leading causes of cancer in the US and one of the leading causes of cancer-related deaths. So screening is very important. Fortunately, it's one of the most preventable cancers, and if caught early, survival rates are excellent. Unfortunately, patients feel anxious and delay screening, and they may even feel well. It's important to know that colorectal cancer, especially in early stages, can present with no symptoms at all, so it's important to get screened.
But that note that you just said about this is, preventable and you can treat this, what are some ways that we can work to prevent this disease?
Yeah, the most effective way is to get screened. So whether with colonoscopy or stool-based testing, we can detect colon cancer in the early stages when it's very treatable. And with colonoscopy, we can prevent it entirely by removing precancerous polyps. Another way to prevent it is to make certain lifestyle changes. It's important to maintain a healthy weight, have good physical activity, avoid highly red meats, and increase intake of fruits, vegetables, as well as dietary fiber. Avoiding tobacco and limiting alcohol is also very important. It's also important to be aware of your family history. If you have a parent, sibling, or a close relative with a history of colon cancer or an advanced polyp, it's important to talk to your doctor about getting screened sooner.
And why is it that so many young people are now receiving this diagnosis?
Yeah, unfortunately, this is an alarming trend we've been seeing in the last decade or so. Increased prevalence of colorectal cancer in younger patients, particularly in those between 30 and 40. There hasn't been one specific cause we've identified, but multiple factors, including increased rates of obesity, decreased physical activity, diets high in processed foods, as well as red meats, as well as changes to the gut microbiome. As a result, screening guidelines have changed recently to recommend screening start at age 45 instead of age 50. Furthermore, patients should be aware of alarm symptoms, which may prompt them to get screened sooner. So symptoms such as rectal bleeding or blood in the stool, unintentional weight loss, persistent abdominal pain, or changes in bowel habits.
And when in doubt, contact your doctor, right? And
exactly.
Make an appointment and just double check. Better safe than sorry. Thank you so much for being here and for sharing all of that with us as well. Again, it is Colorectal Cancer Awareness Month, so a great time just to study up on all of these signs and symptoms. Make that appointment with your doctor as well. And we are going to post this so you can watch it again on WKRN.com.